Item 1A is the examiner's overall impression of patient alertness. Normally, you'll get enough information when taking the patient's history to make this assessment. Ask the patient 2 or 3 questions about the circumstances of the admission. Stimulate the patient by patting or tapping the patient, or on occasion, more noxious stimuli such as pinching may be needed to check the level of consciousness. Good morning.
Good morning.
Are you having any pain today?
Little pain.
Little pain? Are you comfortable now?
No. Yes.
Okay.
For scale item 1A, this patient scored a 0. Let's look at how this scale item is scored. Score a 0 if the patient is alert and keenly responsive. Score a 1 when the patient is not alert but can be aroused with minor verbal stimulation. Score a 2 for the patient who is not alert and requires repeated stimulation to attend, or who requires strong, painful, or noxious stimulation to make movements. Score a 3 if the patient makes only reflexive posturing movements in response to repeated painful stimuli. A patient with a 3 on this scale item is generally considered to be in a coma. A patient suspected to be in a coma should be stimulated by rubbing on the chest or by using a painful stimulus. A 3 is scored only if the patient makes no movement other than reflexive posturing in response to noxious stimulation.
If it's difficult to choose between a score of 1 or 2, continue with medical history questions until you're confident in assigning a score. This is the only time you are allowed to go back and change a score. A score of 3 requires particular attention because it has an impact on how you'll score other scale items. In patients who appear to be in a coma and who score less than 3, you must attempt all items, but realistically, you will likely fall back on the predefined default values for coma patients. I will discuss these default values as we go along. They're also summarized in the scoring manual. You must choose a score, even if confronted with obstacles, for example, endotracheal tube, language barrier, orotracheal trauma, or bandages.